Hello, and welcome to A Live with Amanda. Today, I'm going to actually share something about my practice and something that we learned by changing up how we collect data from clients. So, on our website, we have a form where people can fill out. It's like an appointment request form, even though it's not for a specific time or specific therapist. And we started to ask a lot more questions. We had a form up there, but it was really like, name, email address, what are you coming in for? And so we weren't really able to look at all of the data in any kind of robust way. So over the past 2 weeks, we changed the form and we've been getting a decent sample size now, right? Like, so there's about 50 people who have requested appointments through that. So we have about 50 people's worth of data. And there are a couple of things that really stood out to me. So if you aren't already collecting some kind of data from your clients, I think it's really important that you do that. We use a Google Sheet now. It's really easy. It's really simple. Or a Google form, and then it can go over to Google Sheets. It's really great. We realized that some of our intake information was kind of lacking. I can also put a link below so you all can see it when you're watching this video to see what we started to collect. Feel free to use what we collect. I looked at a couple other people's and it was really helpful to get an idea of what other people did. And I took some things that other people did and I was like, no, we don't really need that information, or we don't do that kind of, whatever it is that they do. And so there were a couple of things that really stood out to me is that so many people were requesting evening appointments from 6 to 9 and weekend appointments. I knew a lot of people requested afternoon appointments, but I assumed the bulk of the appointments were like from 4 to 7, let's call it, or something like that. Even that's not the way we have our times out. I was really surprised to see how many people really wanted those later appointments, especially when a lot of therapists, and I totally get it, don't want to work those later evenings. You might have children, you might want to go to bed earlier, that will bring burnout for you, whatever it is. So I totally get it. But a lot of clients requesting that. And then the same thing with weekends. I was really surprised at how many people were requesting weekends. We have a handful of therapists that work on the weekends, but we have the bulk of our therapists honestly work Tuesday, Wednesday, and Thursday. People want Mondays off. They want Fridays off. I get it. At one point I was taking Fridays off. Loved that, like not seeing clients. I used to work like Saturdays. Sometimes I would even pop in on a Sunday if I had a client with like a different kind of schedule. And then I was working Fridays, and then I stopped working the weekends, and then I stopped working Fridays. So like, I totally get why therapists move to that model. But if you're trying to build your caseload, right, you're just starting out, you want to follow what the clients are asking for. Okay. So the other thing that really stood out to us is how many people were really coming in for anxiety. Now that makes sense because we do a lot of advertising around anxiety. And that was the number one thing that people were asking for. The number two thing that people were asking for was help with their relationships. So relationship problems. And that was really not necessarily surprising because again, we market depression, anxiety, couples, like we market all of this. It's a part of our plan. We use those keywords on our website. We have AdWords up for that. So it's like, it makes sense, but it's like, it's great to see the data. It's great to see like our efforts are actually working. And so many of our therapists, I think all of our therapists for the most part work with anxiety. So that's a good fit, right? It's not like we have all of these therapists, it's not like so many people were asking for eating disorders and we don't have enough eating disorder therapists, right? We really have enough people that work with anxiety. So that was good. Then the relationship problems, we started to notice that during the pandemic, how many people were requesting for couples counseling, relationship problems, communication issues, marriage counseling, et cetera, et cetera. And so what we did is we actually started to get all of our therapists that wanted it trained in Gottman level 1 and level 2, because that really helped get them the basis to start working with couples if they hadn't had a lot of experience, or they had experience, but not the training. And then it matched the needs of the clients. So that was really cool to see. I'm going to tell you one more thing that we saw that was really interesting. But first, I want to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that is really full service, one that can help you run data for your practice, whether you're looking at how many sessions you did per month, what your collections are, what client balances there are, what revenue you have by payer source, I love pulling all those reports. So if you're a report person, I highly recommend you check out TherapyNotes. You can bill insurance through there. You can make customized forms now. They have 24-hour customer service. They have a free telehealth option. It's a really robust electronic health record. And I highly recommend it that you check it out for your solo or your group practice. So the other thing that we put on there was therapy techniques. And we thought like maybe people would know what therapy technique they wanted. And the number one that people were requesting was CBT. Again, we advertise CBT and a lot of our therapists do CBT, but the number one was unknown. People are not familiar with therapy techniques like we think they're familiar with therapy techniques because we're therapists and this is what we do all of the time. And so that was kind of interesting. I think we'll keep that on there, but we'll use it less to make decisions. We'll use the symptoms that they share, like anxiety, right? What's the evidence-based treatment for anxiety is CBT. So that makes sense that maybe CBT was the highest or that we would train our clinicians in CBT. And again, because our number 2 was relationship issues, we would train our therapist in Gottman, EFT, some kind of couples counseling, and we would encourage that. So we're using this data really to make decisions about our intake process, about the therapy that we provide, about the trainings that we provide to our clinicians to really make a robust practice where we are matching the needs of our clients to the needs of our therapists in some kind of happy harmony that we hope works out. So if you aren't already collecting this kind of data, I highly recommend that you do that. And I hope that it is helpful. I will see you soon, everybody. Bye.